Let's talk about the good and the bad of this decision and of the Affordable Care Act. What's the good? Well, 67,000 people are now enrolled in pre-existing conditions insurance plans. 3.1 million young adults were insured because they were allowed to stay on their parents' insurance as a result of the Affordable Care Act. 20.4 million women gained free access to preventative services, including mammograms, cancer screenings, and prenatal care. That's all good. 105 million Americans no longer have these lifetime limits on the benefits that they can be reimbursed for by their insurance company, and $3.2 billion saved on prescription drugs that were previously in the Medicare donut hole. That's all good. Now, what's bad about it? I have some concerns. Number one, as I mentioned, we're putting more people into the for-profit healthcare system, a system that I think is fundamentally not only broken, but immoral and the wrong system for this country. Number two, doing so is going to give even more leverage to the insurers because, let's be honest, an even higher percentage of the residents of the United States are getting their care funded by or covered by for-profit insurance companies. That's a concern to me. And in the long term, what's the negative effect of that? I think it may make it more difficult to move to a real single-payer system. No matter what the results of the Supreme Court ruling were, either way, we were still going to have 26 million Americans uninsured. That's still a concern. But moving forward, I think this may make it even a little bit more difficult as it was going to be, to move to a single-payer healthcare system.
Probably. I mean, I think the only way we're going to move towards a single-payer system is if states individually adopt single-payer systems like Vermont we're waiting on, right?
Right.
So we'll see how that works. I mean, until there's a majority of states that do that, certainly it will never happen.
Yeah, and I'll just add to that I think that Switzerland and a few other countries prove that you can have a universal healthcare system with manageable costs that works with private insurers. And I think that this is moving us in that direction.
You think that it is?
Well, I think that if this law isn't repealed next year with a Republican House and Senate and potentially a Republican president, and it's fully implemented in 2014 and 15, then you're going to see the country move in the direction of having universal coverage, probably with more laws that need to be passed, but a totally private system.
I'm just not sure about that.
Or a mainly
Louis.
private system.
I'm really not sure about that.
I don't know. I mean, I don't think a universal healthcare system with private insurers is the way to go. I think the private insurers need to be cut out. But if we can somehow achieve that, I guess it would be better than what we have now.
It'd be better.
So.